Good evening, Laura. Prather. How are you?
Good. How are you doing today?
I'm good. Could you start off with just telling us what you do and like what you are and what you do and why did you decide to go in your field?
Okay, so I am a speech language pathologist. I have been practicing for about 6 years. I've worked in the school setting and I've worked in private practice. Within each setting, the populations that I've targeted were students, more pediatric. The youngest maybe like Head Start, and then I've had a few adult clients. So currently, right now, in the midst of my career, I am pursuing my in communication sciences and disorders, which is in the allied health sciences. And I have a focus on language and literacy in underserved populations. So for me, more looking at preschool age to elementary age levels and how dialect, more specifically African American English, like affects them within the schools. So I decided to go into this field. It's a very interesting story because originally my mom introduced me to the field and I kind of like pushed her away. I was more like, hey, I'm going to be this medical doctor in some kind of way, if I was going to be like a physical therapist or work somewhere. But I was going into medicine. That was originally my choice. And so when I got to undergrad, I was on my way until I hit physics, and then physics made me change my mind and reevaluate my life. And so I did some more research on communications because that was just an area that I felt like I was really good at naturally. And I liked to tutor as well. So I wanted a way to blend my two interests or passions together. So I researched communications in health, and speech pathology came back up again. So that is how I got into my field. And so then I took the prerequisite courses because at the time I was attending the University of Memphis, and so they have the master's program, but they don't have the undergrad. So I did some post baccalaureate, and then my journey began.
Why did you decide to get your doctoral degree or go back to school for it?
Woo, okay, so again, that was not in my career plans. I was presented with this opportunity from one of my mentors, and at the time I was working in the school setting, and I was just really seeing there's a gap with Black African American students, Black students, and literacy, and something for me was like driving. Like there's we got to do something about this, and so I received an email from my mentor about this grant opportunity to pursue my doctoral degree in language and literacy after reading it. And I was like, oh, wow, maybe this is something I can do. So I wasn't really intentional about applying for a doctoral program. It's just opportunity presented itself. And so I just took a chance on faith pretty much and just said, if I get in, hey, if I don't, it's whatever too. So yeah, that's pretty much what brought me back to school.
What would a typical day look like for you?
In which setting? Like as a student or like a professional?
Both.
Okay, so I did. So if I take it back to professional life, I was a go like a hard worker. Like I worked most of the time Monday through Thursday, 12-hour days, and that was by choice. So what I did was I would start in the mornings at my school, whatever assigned schools that I were at for that day, and I would see clients. Or yeah, service them. Sometimes we would have like IEP meetings. So the day can sometimes be unpredictable, not knowing or if kids go on a field trip and things like that. But most of the time it was kind of whatever the school setting was allowing me to do. Ideally we had a set schedule, like, Monday I'll see these kids, Tuesday these kids, Wednesday, like all of it was pretty much planned out, but you just never know with especially with paperwork and then departmental meetings, those intertwine as well. So after the school day, probably around like 3, I would head to the private practice, and then I would have really just a set schedule, and it kind of slowed down. So the schools was a little more fast, and then the private practice kind of slowed down. I would pretty much be seeing those after school kids that were coming to private therapy. And so I would see like one at a time, and it was pretty consistent usually, unless I had like an assessment thrown in there during the time that I was working. So I would usually get off around like 8 p.m. and then go home, and then the day kind of repeats itself for my professional setting. in my doctoral life, it's been a lot going on. I guess to me, like it's like a tree branch. It's like I'm here, but then I have to do stuff here, here, and here. So since I'm on a grant, I have requirements. In the beginning, it was required for me to be a Head Start supervisor, which is where I supervise one of the master students within a Head Start setting. And then it became something where I did by choice because I felt like I was really helping students and I felt a passion for that to help them really be the best therapists they can. And so I signed up to do those things. So usually 2 days a week, I would go to a Head Start setting. And then if I have coursework or anything, go to class or any things like that, or if I had meetings with my advisor, those would be fit in between time, but I would have to prioritize my time, like with assignments and things like that. So then eventually during my program, I picked up co-teaching classes or TAing classes. So then I also have to make time to grade the assignments of the students. And then now also my research is involved in that. So finding time to blend all of that in. And so I kind of make my own schedule. It just never really stays the same, but I know consistently, like if a meeting is a set time, that's a set time. And then a Head Start is a set time too. And then just filling in the gaps between then and there.
And how is being a Black woman in your field? How has that affected your experience?
Ooh. I tell you, it has affected it in a lot of positive ways, but I have experienced the worst of the worst. When I was a master's student, it really played a role. In my experience with my first school placement, I had a supervisor who was not, I guess, keen to me and how I looked. And so I experienced, I was incompetent to her. I was like a novice level, but I really wasn't. She wasn't trying to help me. She was concerned about like what I wore. She wasn't very helpful. She kind of left me on my own a lot, but then had a higher expectation because of whatever was going on in her mind of me to be this expert in children, but it was a learning stage. So it's kind of like you're supposed to be guiding me and leading me. And then she just, what hit the fan was she just wasn't the best. And so what hit the fan was she asked me what I wanted to do for my next placement. And it was like casual conversation. I didn't complain to my department. I didn't tell anybody about it because I just didn't want, it to feel like I'm the problem. So I told her what I wanted to do. I was like, oh, I'm interested in a hospital setting. And I guess she had a friend in the hospital that I wanted to go to. And she sent him her text messages saying that I was always late. I didn't do my stuff on time, just really be like bad mouthing my character. And it got back to the department and they were going to seek legal. And I didn't even know what was going on. And of course, I was crying. So then that put me in a place of like low self-esteem. Like I already have this imposter syndrome. And now somebody's telling me I'm doing stuff and I'm not. So yeah, I've experienced it in the worst way possible of discrimination or in racist perspectives as compared to some of my peers. But it's also been a blessing too within that. I found myself when I came to UC being a person that is making a path for the next generation. When I met some of the master students and even some of the they were like, hey, can I talk to you? I need advice. I was actually a mentor to them or become a mentor or somebody that could just be a sounding board if they have problems to ask what they do. So, and if they're facing any problems. So that's what I feel like the positive and the blessing has been, just to be that for them and understanding the perspective that they're coming from, especially being at a predominantly white institution as compared to me where I was at a historically Black college and university. So it looked different. So yes.
So would you say that your negative experiences kind of drives your reasoning and your passion for trying to diversify the healthcare workforce?
Yeah, I think so now. I think originally when I got into the field, I really didn't pay attention to the demographics of like race. until I really was like, oh, wow, there's not a lot of us. And so from then I was connected to like the National Black Association for Speech, Language, and Hearing, where now I currently sit on the board, but understanding that a lot of us have the same stories, just at different levels. I have experienced racism at a professional level, but to me, it's just kind of like, you know, you kind of are going to expect some kind of discriminatory things, especially being a Black woman. But I feel like now it really has driven that force, and advocate not only for that, but just to advocate for students in the schools that, you know, may face implicit biases and perspectives from their teachers or anything like that. So a lot of it kind of revolves around advocacy piece of where I've kind of gathered during my doctoral process as well too. So yeah, I would say yes. Yes.
And throughout the discrimination that you faced, how exactly were you able to deal with that?
Ooh. Okay. How was I able to deal with it? It was hard. I'm not gonna lie to you. I think I went through a period of like close to depression because, you know, I had to with that experience, I had to redo my school placement, and it really hurt me in a sense where my mom, she understood where I was coming from. She's a professor at a university in Tennessee, and she was, you know, she said, I'm sorry you're dealing with that. You know, she just helped walk through me, and she had to feed me positivity to know that it's not me. But I think it affected my self-esteem in more ways, like made me question myself, to the point where my clinical supervisor, when I was actually a clinical fellow after I had graduated, saying, you know your stuff, you just need to be more confident in saying it. And I think when I heard that, I was like, oh my gosh, the PTSD from that experience, it has carried over. And so I had to learn how to reassure myself in many different ways. It's something I will never forget, but it's something that I use to push myself to know that, you know, I am supposed to be here in the space that I am. So that's pretty much what it's done. I try to switch it into positive, but sometimes, you know, naturally it still comes out like the residuals of that when you hear, I guess, negative comments, or kind of gives me some, it's a trigger to even be in like big white spaces, and it's like, oh gosh, you know, like what are their biases already, because, you know, I walk through the door. So yeah.
Dr. Sosa, do you have any questions?
Yeah, so I teach a class called Exploring Health Professions, and it's open to all students who are exploring, or maybe they think they know, usually first-year students from any major. And, you know, a lot of them don't know about speech-language pathology,
Mm-hmm.
and a lot of them don't know that it's predominantly white women. And so I really want to expose more students to the field, and especially students of color. So what advice, if you had one thing that you could give to undergraduate students who are still truly sort of exploratory pre-health, what advice would you give them about speech language, about especially students of color, to consider the field?
That I feel like any kind of health profession, there's going to be challenges. And when you face those challenges and dreams that you set for yourself, like, don't give up on them, because your perspective, your experiences matter, and they're helpful. And that delay is not denial, because the classes are like so small and the requirements to get in. But just surround yourself with great mentors and people who are pushing you, and get to know people, if you can, and reach out and email, and just keep going. Like, you just can't let it stop you, because if you don't, like, you'll just always push yourself down to not really doing what your heart desires. So yeah, that was a lot. I know you said one thing, but I feel like five. But I just really feel like, just don't give up on yourself, regardless. Mm-hmm.
That's great. Thank you. I really appreciate your perspective. And it actually really falls in line with a lot of what we've heard about, you know, pushing through and determination and finding a support system, especially a mentor. So thank you.
You're welcome. Thank you.